The initial operation was a heart bypass, which was very successful. But unfortunately, after the operation I had complications and I caught MRSA, which stopped it healing. I come home after that time and it was still 10 centimetres long and I think 4 centimetres wide. And every time you breathe or cough or sneeze, it rips the wound open. So I was on a lot of painkillers. The nurses would come in every day to change the dressing. And you can imagine, you can't do or go anywhere when you've got nurses coming in. So yeah, my life was sort of completely on hold.
I met Janet 6 years ago in the hospital, and she was then an inpatient, which we were referred to see her wound. And obviously once the patient gets discharged, we don't get to follow them up. It's been a year now that I'm out in the community, and one of the district nurses said, "We really want you to see a patient called Janet Benton." And I thought, oh, but that's the same one we saw 6 years ago.
To be honest, it never got any better. It was just always smelling and always weeping. And that went on for 10 years.
You could still see when she was breathing, her sternal bone was going open and close, and you could still visibly see the bones. It was very deep and the edges was very macerated. You could see the exudate that was chucking out every time it closed. The colour of the wound bed was just grey. You could clearly see it was not vascularised at all.
Luxmi started using the Granulox, and within 3 times of using it, the colour had changed from grey to pink. You could see the wound was healthy.
As we progressed, we saw the wound bed go from grey to red and eventually from pink. And at the moment, you cannot see the sternal bone at all. It's completely covered. We got mid part of the wound, which has completely knitted, only healthy tissue visible. Very easy to use, just spray 5 centimeters from the wound bed and it targets the area directly.
I was able to put underwear on and it didn't ooze out, doesn't smell.
Janet is the biggest success I've had because, you know, having a wound for so long, you imagine the biofilm, the chronicity of the wound.
For the first time in 11 years, I feel like it's going to heal up and I'm going to get my life back together.